Hi, my name is Sri.
And I'm Will. We work at Great Ormond Street Hospital for children in London.
Our team works with children and young people who have complex and often rare problems with their eyesight. And of course, we also work with their families and carers to help them understand the care needed.
In this video, we're going to talk about treatments for eye problems in children.
There are different causes of eyesight problems in babies and children. The treatment needed will depend on the cause. If you're concerned about your child's eyesight, it is important to talk to a healthcare professional, a GP or optometrist, for example. If the problem is diagnosed quickly, there could be more treatment options. Sometimes eye problems may be a sign for something else that's not right, such as a problem elsewhere in the body. This is quite rare, but speaking to a healthcare professional can help look into this.
Glasses are a treatment for many eyesight problems. It's common for older children to be prescribed glasses, but there are circumstances where we would prescribe glasses for younger children, less than the age of 7, and even for babies. Glasses work in the same way for children and adults, but they can look very different.
Here are some baby glasses. You can see that they're more flexible, which makes them more comfortable and resistant to breakages. And they have a strap so that they stay on when babies are wriggling around or on the move. Babies may not understand why they need to wear glasses, and it may take some time for them to get used to wearing them.
Glasses work by using the lenses to help the light focus before it goes into the eye. If the eye's natural focusing ability may not be working properly, the brain interprets the signals from the eyes as a blurred picture. Therefore, the eye needs the lenses of the glasses to help with the focusing. They are prescribed for focusing problems such as long-sightedness, where objects can look blurred, especially at closer distances, or short-sightedness, where objects can look blurred, particularly at longer distances, and for astigmatism, which can affect your vision at all distances.
Next up, patching. Patching can also help for some conditions like lazy eye. Sticky patches like these are usually worn on the face over one eye and sometimes under glasses. By covering the eye that has the better vision, the brain is encouraged to use the weaker eye so it learns to interpret electrical signals coming from it. Hopefully, the brain will then start writing the software needed to interpret clearer pictures from that eye.
It's a gradual process that takes many months and sometimes years to work. The amount of time a child would need to wear the patch will depend on lots of things like how old they are, how much difference there is between the vision between the two eyes. Wearing a patch can be unpleasant for a child, and it can be challenging for parents and carers to apply this treatment. It can help to set a routine and expectations for when they will wear the patch, for example, what time of day or what activities they will do. We encourage parents as much as possible because the time window in which patching is most effective is limited to the earlier years of childhood.
Special eye drops can sometimes be used instead of a patch to limit vision in the good eye so that the weaker one can grow stronger.
We are often asked if eyesight problems can be cured. There are some problems that can be cured or improved. For example, a lazy eye can improve with patching, or a squinting eye or droopy eyelid may be improved with different types of surgery. But sometimes a combination of glasses, patching and surgery may be needed. However, for some children that develop eyesight problems in childhood, there may not be a known cure yet, and we may try to help support their development, social and education in other ways.
For children with a visible eye condition such as a squint, where one eye is positioned differently compared to the other, or there's a droopy eyelid, their eyes may look different to another child's. Being different, especially around the eye area, has been known to cause some anxiety for children and their families. It's important that they have someone to talk to so they can be supported as much as possible by family, friends, their school and the health system. It's important to remember that eyesight problems are common. Around 1 or 2 in 30 children have a squint, so they're not alone. We've seen children grow up to live happy lives, full of rich experiences and adventures.
Take a look at our other videos if you want to learn more about eye health in children.